Hello guys, so now we shall be discussing regarding the eighth pair of cranial nerve, that is your vestibulocochlear nerve. Okay, so our topic of discussion would be regarding the vestibulocochlear nerve. So what is your vestibulocochlear nerve? Your vestibulocochlear nerve is your eighth pair of your cranial nerve, right? Now in this we shall divide this vestibulocochlear nerve into two components. One is called as a vestibular component, another one is called as a cochlear component. Okay, and all of you know one very important thing, that vestibular component is responsible for the balance, whereas the cochlear component is responsible for the hearing. So one is responsible for balance and the other is responsible for the hearing. Now you can see this particular picture which I have drawn here before itself. So this is a picture of your inner ear. Now within this inner ear you see two cavities over here. See, this is one cavity, right, and this is another cavity which you can see, right. What are these two cavities? So one cavity is called as utricle and the other cavity is called as saccule. For example, see here, this particular cavity over here is called as utricle and this particular cavity over here is called as saccule. Okay, utricle and saccule together you call it as maculae. Utricle and saccule together you call it as maculae, right? And if you can see here, how many semicircular canals are there? There are three semicircular canals, right? So this is 1, 2 and 3. Three semicircular canals are there. Near the tip of the semicircular canal is dilated. You see how many dilations are there? This is 1, 2, 3, 4. There are 4 dilations of the semicircular canal. So this dilated part of the semicircular canal is what is called as ampulla. The dilated part is what is called as ampulla. Okay, so this is called as ampulla. Now if you look very closely inside, within this ampulla there are some hair cells. You see some green color cells which I am drawing. So these are some hair cells which are located within this ampulla. So what is the name of these hair cells which are located within this ampulla? These hair cells are called as cristae ampullaris. So this ampulla is having hair cells. These hair cells are called as cristae ampullaris. Cristae ampullaris. So these hair cells are called as cristae ampullaris. So far we discussed there is something called as utricle and saccule. Utricle and saccule together is called as maculae. Next the dilated part is called as an ampulla. Ampulla is having hair cells called as cristae ampullaris. Now here if you see, this part is called as your midbrain, right? This is your pons and this is your medulla oblongata. And the junction between pons and medulla oblongata, this junction is called as pontomedullary junction. Okay. And all of you know that in your ear you have got two meatus, external auditory meatus, internal auditory meatus. So this meatus which I have drawn over here is internal auditory meatus. This is called internal auditory or acoustic meatus. Internal acoustic meatus. This is called internal acoustic meatus. Now what I am telling you is that, let me draw it with the red itself. So here let me first draw few nuclei. Okay, so what are the few nuclei are between the pons and between the medulla, right? In the pontomedullary junction, you have got this particular nuclei. So this particular nucleus which I am drawing right now is called as a vestibular nucleus. So this is called as a vestibular nucleus, right? Actually there are 4 nuclei within this. So this vestibular part, whatever I am drawing right now, is having 4 important nuclei. What are these 4 important nuclei? For example, the first nucleus which you can see over here, is called as a superior nucleus. This is a superior nucleus on both the sides, right? This is the inferior nucleus on both the sides. Next, here we have got the medial nucleus and here we have got the lateral nucleus. So how many vestibular nuclei do we have? 4. Superior, inferior, medial and lateral, right? How many pairs we have got? 4 pairs, but actually in how many we have got? 8. So all these nuclei together is called as vestibular complex or vestibular nuclear complex. Okay, it is having a complex of all these nuclei, so this is called as vestibular nuclear complex, right? above this vestibular nuclear complex, you have got another nucleus over here. The same nucleus is located on the opposite side as well. This is the nucleus for the sixth pair of cranial nerve, that is your abducent nerve. Next, if you go little bit above in the midbrain, you have got another nucleus over here. This is the nucleus for your oculomotor nerve, that is your third pair of cranial nerve. Okay. Next, little bit above if you go, here you know that you have got structure called as thalamus. So this is called as thalamus. In the neuroanatomy we discussed there are many nuclei within the thalamus, right? But one of the nuclei which I want to tell you over here is ventro-posterior-median nucleus. Okay. So I am drawing this. See, this dot which I am putting over here, is nothing but your ventro-posterior-median nucleus. Okay. So where is that present? That is present on the thalamus. And all of you also should know this very important thing, that on either side of the thalamus you have got what? You have got the internal capsule. And remember one thing, do you know that there are two different capsules? One is called as internal capsule and outside you have got is the external capsule, right? So this is your internal capsule. Okay, right. Next, little bit above here, let me draw the eyeball. Let us say this is your eyeball. Just a rough picture representing your eyeball. Okay. You know your eyeball is having different kinds of muscles. Let us say the muscle that is located here is called as your medial rectus. The muscle that is located here is called as your lateral rectus muscle. Same way, the medial rectus muscle and on the other side the lateral rectus muscle. So let me write it as MR medial rectus and LR lateral rectus. Okay. So what are the things we have discussed? We discussed that inner ear is having cochlea. It is having maculae. Maculae is having utricle and saccule. The semicircular canals are 3. Dilated part is called as ampulla, and ampulla is having what? Hair cells. And these hair cells together you call it as cristae ampullaris. Next, internal acoustic meatus, and here how many nuclei we have got? 4 nuclei. These 4 nucleus of the these 4 vestibular nucleus together is called as vestibular nuclear complex. Above that we have got abducens nerve nuclei. So how will I write it here? Yeah, I'll put a dot over here. See, this dot, pink color, and above that the reddish color dot. So this would indicate what? Abducens nerve, and the upper one will indicate your oculomotor nerve as well as your abducens nerve. Right. Coming to the pathway, first important thing you need to know here is that all from this cristae ampullaris. What is this dilated part? This dilated part is called as your cristae ampullaris. From this cristae ampullaris, you see the nerve fibers that are coming out. You see nerve fibers from all the parts of cristae ampullaris are coming out, and these nerve fibers, they come all the way and enter into your internal acoustic meatus. And once they enter into the internal acoustic meatus, within the internal acoustic meatus you have got a neuron. Okay, let me use green. Okay, you have got a neuron like this. Now this neuron is having two processes. One is called as a central process and the other is called as a peripheral process. Now what is happening is that this particular process, that is the central process, this central process is coming all the way and it is going towards the pontomedullary junction. The junction between pons and medulla oblongata is pontomedullary junction, and this will relay on your vestibular complex. Okay, it will relay on your vestibular complex, or I can also tell you that this is activating your vestibular complex. Okay, once it activates your vestibular complex, what is the second thing that is happening? Your all nuclei, the superior, the medial, the lateral, the inferior, all these nuclei are activated, right? Now once all these nuclei are activated, what I am specifically telling is that from the medial part, okay, you see here from the medial nucleus, the axons, the nerve fibers are coming down, right? They come down all the way into your ventral part of the spinal cord. In the neuroanatomy, I have already taught you that spinal cord is divided into two portions. Above this line is called as a dorsal, below this line is called as a ventral. Above this line, the neurons which are present are called as the sensory neurons, and below this line, the neurons which are present are called as the motor neurons. So, this is called as the ventral part, this is called as the dorsal part of the spinal cord. Now, where is this axon coming? From the medial vestibular nucleus, this axon is coming down all the way into the ventral part of the spinal cord. Now, from here, the next order neuron, that is a lower motor neuron, will enter into your ventral horn, and then it goes all the way and supplies to your skeletal muscle. Not supplies, it innervates your skeletal muscle. So, from the median vestibular nucleus, the blue color tract which is coming down is called as upper motor neuron, and from the spinal cord, the tract which is entering into your skeletal muscle is called as your lower motor neuron. Okay. So, this upper motor neuron, I am naming it as A, and this one I am naming it as B. Okay. And what is A here called as, and what is B here called as? A all the way from the vestibule to the spinal cord. Yes or no? From the vestibular complex, this line is coming till the spinal cord. So that is why it is called as vestibulospinal tract. But within the vestibule, exactly from which nucleus it is coming? Median nucleus. So median vestibulospinal tract. Median vestibulospinal tract. Next, in the same way, if you watch carefully over here, even from the lateral nucleus also you see a fiber that is coming down all the way, and it is relying on the lower motor neuron, right? Again, that also does the same action, that is skeletal muscle contraction. So this spinal tract over here is called as, is it called vestibulospinal? Yes, it is called vestibulospinal, but from which nucleus? Lateral nucleus. So lateral vestibulospinal tract. Lateral vestibulospinal tract. Okay. So this is called as your lateral vestibulospinal tract. Right. So two tracts over here. One is called as the medial vestibulospinal tract. Another one is called as the lateral vestibulospinal tract. So there are two important tracts over here. Right. After discussing these two important tracts, what is happening? What is happening is that if you can closely look from the medial nucleus, one fiber is going down. Yes. Now from the same medial nucleus, another fiber goes up, but this time this fiber, and by the way, tell me, these two fibers, whatever I have discussed, median vestibular tract and lateral vestibular tract, are they ipsilateral or contralateral? What do you mean by ipsilateral? What do you mean by contralateral? If the tract is going opposite side, that is called as contralateral. If the tract is on the same side, that is called as ipsilateral. Now tell me, did the blue color line cross to the opposite side of the spinal cord? No. It is on the same side. So that is why you call this tract as, these two tracts as ipsilateral. Now tell me, the line which I will be drawing now, is that ipsilateral or contralateral? From the median vestibular nucleus, a tract goes all the way up and activates your which neuron? Which nucleus? Abducens nerve nucleus. Now tell me, this tract, whatever I have drawn here, from the median nucleus of the vestibular component till the abducens nucleus, tell me, this is ipsilateral or contralateral? Obviously this is your contralateral fiber. So obviously no surprise that from here also one fiber goes and activates here, contralateral. Now what will happen? Your abducens nerve is activated. Now once your abducens nerve is activated, what is happening? From your abducens nucleus, a nerve arises like this, and this nerve goes all the way up, and it innervates which muscle? Lateral rectus. Right? Now for example, if let us say that this is my left eye, this is my right eye. Okay. Now to the left eye, the lateral rectus is not working. What does it mean? Where might be the injury? The injury will be on the same side? No. The injury might be to the median nucleus on the opposite side, to the vestibular nucleus on the opposite side. You're getting it? See, you see this entire thread, right? So, if there is an injury over here, what, for example, if patient is having injury at the level of the pons, if there is an injury of the tract, what is happening? The opposite side lateral rectus will not work. For example, if the patient is having injury at the level of midbrain, here, if the patient is having injury at the level of midbrain, now tell me, the same side lateral rectus will not work or the opposite side? The same side lateral rectus will not work. I hope you understood, right? So in the same way, fibers from here also, this abducent nerve goes to the lateral rectus all the way here. Okay, so this is done. Next, abducent nerve you have activated. Now once you have activated abducent nerve, two functions are happening. What is the first function? First function is that this abducent nerve directly innervates your lateral rectus, so it will activate your lateral rectus, it will contract your lateral rectus. Okay. Second action what is happening is that this abducent nerve also gives out one more branch that innervates your oculomotor nerve like this. You see, that innervates your oculomotor nerve, So what is this cranial nerve? This is your oculomotor nerve. Now oculomotor nerve is activated. Now once oculomotor nerve is activated, what does oculomotor nerve do? Oculomotor nerve also sends fibers all the way to your which muscle? It is sending fibers all the way to your medial rectus muscle. Okay, oculomotor nerve is also sending fibers to medial rectus muscle. Clear all of you? So oculomotor nerve palsies are contralateral, abducent nerve palsies are also contralateral because they are crossing, the fibers are dissociating, right? So this is what we discussed so far. Now one last important point I want to highlight over here is that, let me use a completely different color over here. Let me use this, yeah. Now this last important point is that you see the superior nucleus over here, superior nucleus of the vestibular complex. Now from here you see fibers are going up. From the right superior nucleus the fibers go up and they relay on the thalamus. Which nucleus of the thalamus? What is the name of this nucleus? I already told you the nucleus name is ventroposterior median nucleus. So it is relaying on the ventroposterior median nucleus. And now what will happen is that from the ventroposterior median nucleus again the fibers are going up. Okay, let me write it down. The fibers are going up where it is going to the cortex. Okay, they are going up to the cortex. Which cortex are they going up? They are going up to the auditory area. They are going up to the auditory area, or they are also going up to the insula of cerebral cortex. Insula of your cerebral cortex. Okay, they are going up till the insula of your cerebral cortex. So what are the important things you need to know? The first important thing you need to know here is that we have got utricle and saccule. Both of them together you called it as maculae. Next you called this dilated part as ampulla, which are having hair cells. Okay, so these nerve fibers arise, right? They enter into your internal acoustic meatus. From here you see this green color nerve. This is called as your vestibular nerve. Vestibular nerve. What is happening with this vestibular nerve? This vestibular nerve will activate your entire complex of your vestibular nuclei. Once they are activated, now from the medial nucleus what is happening? You see a fiber tract coming down to the spinal cord. This is called as median vestibulospinal tract. You see from the lateral side a nerve fiber coming down. This is called as lateral vestibulospinal tract. Right? So they are ipsilateral. Next, from the median nucleus you see a fiber going to the opposite side. What is this nucleus over here? It is abducent nucleus. It is going and activating your abducent nucleus. From this abducent nucleus, two fibers arise. One fiber goes and activates your oculomotor nerve. Another fiber goes up and activates your lateral rectus muscle. And once oculomotor nerve is activated, this oculomotor nerve sends fibers to the medial rectus. And at the end, from the superior nucleus of the vestibular complex, you see fibers going and entering into your ventroposterior median nucleus. So this nucleus over here, this particular nucleus is ventroposterior median nucleus. Now from this ventroposterior median nucleus, fibers go up and enter into the auditory area or the insula of the cerebral cortex, right? So this is all you need to know regarding the vestibular nerve, right? Cochlear nerve, we will discuss it in a later on video. So this is all you need to know regarding the vestibular nerve. So thank you so much for watching my video. Goodbye.